Hi, welcome to How You Move, presented by HSS here at Chelsea Piers, Connecticut. I'm Justin Clark, the Director of Outpatient Rehab Services for HSS in Stamford. Today we're going to be discussing swimming and injury prevention with a local high school athlete, as well as two of our HSS physicians. I would love if you guys begin by introducing yourselves.
Hi, I'm Kaki, and I'm a local swimmer at Chelsea Piers Aquatics.
Hi, I'm Daphne Scott. I'm a primary care sports medicine physician at HSS. I see patients in Stamford as well as New York. I was a team physician for the 2018 World Championship USA Track and Field team in London.
My name's Sam Taylor. I'm an orthopedic surgeon in sports medicine at Hospital for Special Surgery and also one of the team physicians for the New York Football Giants.
So we have a great panel here today. I'd like to start by maybe Kaki just giving us a little background about what you do here at Chelsea Piers as far as swimming goes.
I swim here at Chelsea Piers 6 times a week, around 2 hours, with some of my best friends, so that's awesome. I swim every single month, so I don't really have any time off, but it's weird because every single month you kind of want like a week off, 2 weeks off, but then when you have those weeks off, it's like that's when you want to get in and like train. So I don't really get time off, but I kind of like it that way because when I have time off, I just kind of want to be back in the pool and doing the thing I love.
Kaki, what is it about swimming that you love, that drives you?
I just love staring at the black line for like 2 hours. No, that was a complete joke.
But that was awesome. I love it.
Yeah, no. I just really like the team aspect and kind of like the self-discipline it like teaches you, like, and I think that like applies in like later life. It's not just like swimming, which I like a lot.
How much of what you do is in pool versus out of pool training?
For me, like for my team personally, we do basically all in pool. We only do like dry land probably 3 times a week. So for most people, that's not a lot. But for us, we just basically do 2 hours and that's it. And then 3 times a week, we do an hour-long like dry land, and then like at the end of that we have like a 15-minute foam roll, and that's kind of like our recovery, and that's how we kind of prepare for like the next day.
You mentioned recovery, so that's obviously a really important part about training effectively and letting your body recover. What are some things that you do to help you recover?
First off, I kind of just start off with sleep. I think that's like the most important thing. So I do sleep and hydration just because I feel like drinking a lot of water is obviously like very good and you don't cramp as much. But other than that, I kind of just foam roll when I need to foam roll and take like Epsom salt baths. And I don't do anything that's like kind of too different.
I think it's really important. The two of the things that you brought up were sleep and hydration. I know that hydration is something that's so important and allows your muscles to recover and to avoid things like cramping and whatnot.
And you both brought up sleep, which is very important for our adolescent athletes. You know, adolescents need about 8 to 10 hours of sleep every night. And unfortunately, many of you guys just don't get it because of the demands of school and your sport. So we know that it's really important for performance, for your overall health. So I'm glad to hear that that's part of what you use as recovery.
Dr. Scott, when is the last time that you got 8 to 10 hours of sleep?
It's been a while. I'll put it that way.
Fair enough. Yeah, that's the sleep. All of those things that the sleep and hydration and appropriate nutrition are so important to build into recovery. It's one of the things that we certainly stress with our players with the Giants is to not overlook the relatively simple things that you can do to keep your body in the best shape possible.
Yeah.
When you do see an athlete in the office, walk us through kind of what your MO is as far as, do they come to therapy? Do you perform certain tests and measures in the office before kind of assessing where they should go from there?
So definitely when someone comes into the office and they're having a problem such as shoulder pain, we like to first start with the history, learning more about when do you have that pain, how long have you had that pain, what have you tried to help with the pain or the discomfort that you're having. It's also nice to know what strokes do you swim. Usually at this age, you guys are swimming all the strokes, but as you become more specialized, or you'll start to swim maybe just one stroke or one event. So really trying to find out what stroke you swim, what stroke bothers your pain, and kind of go from there. I think it's also important for me when I'm talking with someone to know how long have you been training. I know we touched on this a little bit earlier, but also, do you participate in any other sports? What part of the season are you in? Okay. When it comes to the physical exam, it's really important that we take a look at not only the shoulder and the shoulder blade, but we look at the neck. We look at core strength, things like that. Dr. Taylor, do you have anything to add?
Yeah, like in the throwing athlete and a swimmer, oftentimes the end motion comes through the shoulder, but there's a whole kinetic chain that goes through, that starts through the core and works ultimately through the shoulder. So it's important to identify where the weak link is in the chain in order to correct the deficit. Justin, when you see a swimmer, how do you evaluate from a physical therapy standpoint in order to kind of help identify that deficit and make change?
Sure. So similar to how you guys mentioned, as far as the history, what have you been doing to mitigate your symptoms? Have you stopped swimming, or have you stopped throwing, whatever it is? Have you given it a chance, your body, just to rest? And then we do really a complete exam. We don't just look at the shoulder, or the shoulder blade, or the thoracic spine, because there's correlation between all those different body parts. We look at overall motion of the glenohumeral joint, which is the shoulder. We look at strength, and really, it's kind of eye-opening to athletes, to the families, to the coaches about, what we see either in the office or in the rehab space as far as functional deficits and functional strength deficits as well. Because, you think, I'm an elite athlete, I'm a high school swimmer, I'm a college swimmer, I'm a football player. You assume that these athletes are very high, they're very high functioning, we know that. But also we always assume that their strength is at peak level. But what we see in our assessments that there are often times that there are little nuances of certain motions and certain body parts and muscle groups that are not up to where they should be to be performing at the level that you want yourself to be at.
Surprisingly, sometimes we encounter something called scapular dyskinesia, where the shoulder blades just aren't moving correctly or together, and that can hint at a problem. And so I always joke around and I tell my patients, I know you don't have eyes in the back of your head, so give me your cell phone and we'll take video of it. And mom or dad is back there watching with me, take video of it, and then I can show them, hey, I'm noticing these subtle differences. And it's actually very helpful when it comes to time to buy into physical therapy, maybe resting a little bit, that sort of thing.
And one of the other things too that I think is nice about something like this here today with a primary care sports doc, a surgeon and a physical therapist, and an athlete here is that caring for the athlete is a team sport in and of itself. And communication between different care providers, between family members and athlete is incredibly important to stay on top of the problem, to assess progress, and to have open lines of communication that we always strive for with our physical therapists, who get the opportunity to see the athlete over a much longer period of time than we get in a snapshot in the office. And so communication and teamwork that includes the therapist, the physician, the athlete, and their parents is absolutely critical.
And I would even add in there the coach. Every once in a while, I will get on the phone and speak with someone's coach. If it's a coach here, come over here and talk with the coach and really explain what's going on. But I agree, making sure that there is team involvement is key.
It's very important to involve the coach when there is an issue so that they can help adjust the training regimen in order to allow the athlete to get better.
And sometimes I think one of our biggest hurdles is often reining in the coach's You're probably going through a lot of this or hearing a lot of this now, Kaki, with college coming up very quickly. You know, you have college coaches, you have your parents, you have other family members, you have teammates. You know, so the pressure's on, especially as you move up the chain in elite sports and as you go through college and maybe even beyond. So it's like we mentioned, having that collaboration, communication between all those different entities is paramount, because it's not the best idea to return to sport, willy-nilly. There are certain benchmarks that you have to meet, certain expectations you have to meet before safely returning to sport, again, at your level that you expect.
Yeah, and returning safely to sport is the key. We know our jobs are essentially to identify problems that can limit the athlete's ability to perform, or potentially lead to greater harm if they aren't addressed.
We'll be right back with more How You Move, coming to you from Chelsea Piers, Connecticut. How often do you see shoulder injuries in the office from a swimmer that require more than just your standard physical therapy, maybe some rest and anti-inflammatories? How often do they come back yet again for a greater issue?
So swimmers, like runners, are oftentimes challenging to deal with, because you're so passionate about the sport that you love. And the sport that you love requires a lot of repetition. And oftentimes what we really just need to do is allow the athlete the opportunity to rest and get better on their own. But sometimes that's the greatest challenge, is convincing somebody that they just need to take some time.
Exactly. And I think what we always try to get across to the athlete is that if we ask you to stop swimming or stop doing a certain stroke, it's not going to be forever. It's just,
And it's not because we're the team doctor for the other team.
Exactly. It's just so that we can work on the pain, we can get you feeling better. I know a lot of athletes who, it's very important for them to be able to swim at their best. And I tell people, if you're having this much pain right now and you're swimming at 70%, that's not ideal. Let's get you out of the pool. Let's get you feeling better so that when you get back in, you're swimming at your best.
Yeah, exactly.
Kaki, have you had any of these instances of, small little nagging injuries that you didn't quite deal with right away, or anything like that come up in your swimming career thus far?
Yeah. I've had some shoulder injuries just because we were talking about it before, about the repetitive motions of like the overhead, I think that's what it's called. But yes, I've had that before. And when we were talking before about how it's weird how you're kind of weak in some areas, just like during like PT, I've seen that before because I've done PT at HSS before. And I thought that I was like the superhuman because I could swim all these things. But then right when I got out of the water and I was given a red resistance band that was like nothing, I couldn't even like lift it above my head without being like exhausted. So it's weird how you may think that you're very strong like in the pool or in like your sport or anything like that. But then right when you start working the smaller muscles, which are kind of like connect everything, that's where you're weak and that's where you're getting injured. So I think I learned a lot by just doing the small muscles with like the resistance bands. So yeah.
You hit the nail right on the head. I think the hardest part is so much of the time we focus on the big muscles. I say the beach muscles, but we don't do a great job of focusing on the small muscles, the ones that help to support the shoulder and its movement. And so a lot of the times when we are sending people for physical therapy or asking them to do home exercises, it is to work on those small muscles.
and to re-coordinate the shoulder motion.
I think it's very important, and we kind of preach this to all of our patients, whether in the doctor's office or in physical therapy, is that it's not important the number of repetitions you do, the number of laps you swim or strokes that you swim. It's more about the quality of each of those and making sure that you're at your best and 100% on each one of those laps in the pool. Because without that, then you're not the swimmer that you are now.
Exactly.
Just as an aside, one of the other things that we didn't talk about yet that certainly comes into play and was mentioned earlier is where an athlete is in their season and what they need, because that also kind of comes into the decision-making process. I often think back to my high school football coach who would say, are you hurt or are you injured? And trying to differentiate between something that you can potentially work through safely at a particular point in the season, and the things that are important to address at that time.
So, Dr. Scott, in the office, and when you see athletes in the office, how do you explain to them the difference between feeling sore and maybe a pain that they may or not be or should not be feeling?
Yeah, that's a great question. I think that it's different for different sports, but I always tell my patients, if you have a pain that is essentially keeping you out of practice, if it's a pain, say for instance, in your knee, it's causing you to limp, you can't run, or if it's in your shoulder, you can't do your particular stroke, that's something that I get worried about. Now, when it comes to discomfort, some people may have a little bit of very light pain, but they're still able to perform as they're supposed to. That goes away either after they stop practice or, maybe even after a little bit of ice. That's discomfort. I think they can monitor that a little bit longer. But if it's something that's affecting how you run, what your stroke looks like, if it's lingering into the next day, that's something that I think should be checked out.
In the physical therapy world, when we see patients and they're having pain or discomfort that alters their performance, or that, like you mentioned, that lingers for X amount of days, much longer than it should, I think that's when we start to worry about. And maybe we can just comment on overuse injuries versus acute injuries in swimmers. I think maybe we see a little bit more than the other in swimmers. And maybe we see them too late as well, but maybe we can just elaborate on that a little bit.
Yeah. Mostly what I see in my office when it comes to the swimmers is going to be the overuse injury. And a lot of it has to do with fatigue. A lot of the time we see athletes who maybe just haven't trained a particular muscle group as much as they need to for their particular swim. And so they're noticing that the longer they swim in practice, then their pain starts to show up. And so, again, a lot of what I see has to do with just overuse. Dr. Taylor?
Yeah, no, I think that shoulder injuries in particular tend to plague the swimmer. Over the course of a swimming career through high school and college and beyond. Some 3/4 of swimmers will be affected by a shoulder injury or shoulder overuse that impacts their ability to train or perform. The shoulder, it's an amazing joint because it has so much flexibility and so many degrees of freedom to allow the swimmer to do what they need to do. The shoulder in and of itself is a pretty unstable joint that's very reliant on the muscles that surround the shoulder. And so for that reason, it's also prone to fatigue type injuries, the overuse type injuries, where a particular muscle group becomes fatigued and then the motion changes in the shoulder, resulting in pain.
I was going to add to that. Everyone thinks about the shoulder as just the ball and socket part of the joint. When I see a swimmer in the office and I'm thinking about their shoulder, I'm thinking about the clavicle, I'm thinking about their shoulder blade. And a lot of what I think about actually comes from the shoulder blade and the muscles that help to support that. So you have to put it all together. It all moves as one unit. And if we have a breakdown in one part of the unit, it's going to put stress on another part of it. So
different sports have very different demands on the shoulder, and one of the most important things that a successful swimmer like yourself can have is to have exceptional flexibility in their shoulder to allow your arm to rotate through what are unnatural type motions like one would do during a butterfly stroke. The flexibility that is necessary for high-level swimmers to perform also puts them at risk for becoming unstable when in an overuse type setting.
It's often eye-opening to athletes if they do end up in an office with you guys, just how much weakness or how much dysfunction and lack of mobility at times that they actually have. So it's kind of, we have to bring the athletes, back home and really say that you need to work on these foundational movements and exercises just to make sure that your performance is up to what you expect.
Mm-hmm.
Exactly.
We'll be right back with more How You Move, coming to you from Chelsea Piers, Connecticut.
I used to go to HSS for my shoulder, but now it's recovered because of you guys. But before, I remember getting out of practice at like 6 o'clock and having an appointment at 6:15 and easily just getting changed and going right over to HSS, which was like super close, which is so convenient because you kind of get there and then get things done. But also the location of HSS is great because it's around so many towns and so many facilities that it's easy for everyone to get to, and then it's easy for everyone to stay at. So yeah.
It's been great being here within Chelsea Piers. Not only do we have your amazing swim team, but there are a lot of other athletes, hockey athletes, and other athletes who use the facility. And hopefully we can let them know, right around the corner. And if there are any problems, they know that they can reach out to the office and give us a call. We try and get people in as quickly as possible. I think it's also nice having the rehab facility here as well.
I will say on a personal note, having grown up in Fairfield County and having the opportunity to be back here in Fairfield County and treating young athletes that are going to local high schools that I know well has been really exciting and fun for me.
I think a great thing that we have to offer for HSS here in Stamford is that we do have the opportunity to bring the community together as far as we have all of our local athletes here in Chelsea Piers. We have our local high school athletes from all the surrounding areas, and we could treat them under one roof, literally. We have our physicians, we have physical therapy, we have rehab, and then we're also performing surgeries now in Stamford. So to be able to keep it all close-knit in Fairfield County is a great advantage that we have at HSS now. So once our athletes or patients have gone through the process of seeing Dr. Scott, trying more conservative methods with PT or medication, when is it indicated for a patient to come see you for a consultation for surgery in the office?
Yeah, even as a surgeon, the majority of issues that we see in young athletes and swimmers in repetitive type sports are things that respond very well to non-surgical treatment like we've talked about. There are instances where a young athlete may have a problem that does require surgery in order to get them back to a level of play and a pain-free situation.
And a lot of the times, if someone has a pain and I'm worried that it's something very serious, I may order x-rays or may even order an MRI to look a little bit more closely at it. I think it's important when maybe someone's pain is very concerning, or if they're just not getting better with some of the things that we're trying, that we're continuing to work things up. And that may be with additional imaging.
Sure. So oftentimes we get the question in physical therapy, people want an injection, a cortisone injection. They want a magic pill to make all their pain go away. Is this something that you guys see often in the office?
I will say this does come up every once in a while. I think the hard part is we know that the majority of injuries that we are seeing in swimmers are overuse. So I tell people this didn't start overnight and it's not going to end overnight. It's going to take a little bit of time and a little bit of work. Sometimes that may require us using an anti-inflammatory for really significant symptoms, but a lot of the times if we just stop the stroke that is hurting people, if we get them in for a little bit of physical therapy, things will usually turn the corner pretty quickly, especially in a young athlete.
We'd like to thank Dr. Taylor, Dr. Scott, and Kaki for joining us today on this episode of How You Move. Please join us again next time.